Hi there, welcome to the channel VinIQ. Today we'll be talking about a topic called as phobia. So most of the people across the world would be victims of different phobias, and most of them are not aware of this exists and then do not seek treatment for the same. So what is a phobia primarily, and how different phobias are from that of fear? So please understand that fear is a primary emotion of all living organisms across the globe. Often, fear is considered as very useful for the survival, not only for survival, also for evolution. The phobia is differentiated from that of fear in a sense. Fear in general is concerned with an emotional response to current danger or current and perceived danger, but phobia in general is considered as an anxiety response. In general, in a sense, for a future threat there is a fear in the present situation or scenario, or primarily it is assumed danger or assumed threat. So phobia can be defined as an irrational, often sudden and lasting fear of objects or situations or places or people or creatures. So these phobias in general are global, and most of the people suffer from one or more than one types of phobias in general, and most of them do not seek medical treatment. So these phobias in general are caused by many factors, and these are challenging to diagnose, and often many people end up living with these phobias, adjusting, and often these phobias affect their quality of life. So how do we understand phobias? Phobias classification of phobias would be into three categories. Number one is specific phobia. Number two is social anxiety or social phobia. Number three is agoraphobia. So what is specific phobia? It is very specific in nature, and then it is to a particular object or situation. That is irrational fear concerned with a particular object or situation or a creature or any kind of place. And the second one is social anxiety. It is concerned with the environmental factors or the places or the situations wherein we'll have the presence of other human beings also. That is fear of crowded places or fear of speaking in front of people or such kind of situations. The third one is agoraphobia. This is about leaving home and getting trapped and a fear of inability to escape. So this is agoraphobia. So in the first case scenario, this is specific phobia, which may mean that a fear of those objects or creatures or situations which are not harmful in real terms. That is, for example, fear of dogs or fear of heights. So these are not particularly harmful, but it is a perceived or imaginary or assumed fear. In general, this is specific phobia and can be because of a childhood experience or past experience concerned with an individual and a creature or object or a situation or a place. And the second one is social anxiety, which is about meeting people, talking to people, or talking to authoritative figures or public speaking. So these kind of activities in general cause panic attacks in some individuals. This can be considered as social anxiety. And the third one is agoraphobia, which means that confining oneself to only safe and secure environments and a fear of getting trapped in public places like crowded places. They can be markets or movie theaters or religious institutions or markets or shops or shopping malls and tunnels or the subways, wherever there is a crowd, and a fear of not escaping the crowd or getting trapped inside the crowd results in the confinement of individuals only to households or very limited environmental situations. That is your agoraphobia. So these three are the categorizations of phobias primarily. This next one is how many people have such phobias globally? In general, approximately 10 to 15% globally have these kind of phobias, and around 6% of the people have more than one phobia. Next is causes. What causes these phobias in general? Causes of phobias can be understood based on Rachman's classification or different pathways. We have three different pathways which can be understood as causes of phobias. So primarily we have two causes to phobias. Number one is environmental cause and number two is genetic cause. Yes, we can by our research we can understand that around 50% of phobias are inherited. So here Rachman's classification would help us to understand three different types of pathways of acquisition of phobias. Number one is classical conditioning. In general, in classical conditioning, what happens here? The phobia is acquired by individuals based on their own self-experience or exposure to any kind of phobic stimulus either during their childhood or during their adolescence. So by self-experience, when one individual is exposed to a phobic stimulus, that person tries to develop this fear or apprehension and avoids certain kind of creatures, that is animals or objects or environmental conditions or places or any kind of event which may repeat similar kind of experience. So this is number one, that is your specific or classical conditioning. And second pathway of acquiring phobia is vicarious acquisition or vicarious conditioning. So what happens here is when individuals observe others getting exposed to phobic stimuli and experience any kind of unpleasant results by observing, by learning from others, so people develop certain kind of fears. Though one is not personally exposed to this phobic stimulus, by observing others, in general, people develop a sense of apprehension about the phobia, about creatures or places or objects or situations. So this is second pathway of acquiring phobia. The third pathway of acquiring phobia in general is instructional or informational acquisition or instructional acquisition. This is by studying about or by listening to certain kind of explanations or instructions, or through education, through books, or through religious preachings, or because of the advice given by others, when one develops a kind of apprehension or fear or irrational assumed fear of objects or places or situations or persons. So such a type of acquisition of phobia or fear is called as the informational or instructional acquisition of phobia. So these are the three types of development of phobias based on two causes. Number one is environmental cause, number two is genetic cause. So what is environmental cause here? That is when people get phobia because of their surroundings. Surroundings can be in the form of your objects or creatures or persons around. So external factors become the source of fear. In that case, the cause is environmental cause, and second one is genetic cause. So the Human Genome Project and epigenetic studies would reveal that certain kind of epigenetic features, that is environmental factors influencing the behavior of genes. So when behavior or behavioral aspects of genes are modified by environmental factors, such factors which influence the way we behave would become epigenetic in nature, and often such epigenetic components or factors would result in inheritance of phobias, and they run in families or across generations. In general, it is said that if a person is having phobia, that person would have a relative or at least a primary kin with the similar kind of phobia. That means the epigenetic factors are responsible for inheritance of phobias in individuals. So we have environmental factors responsible for phobias, and we have epigenetic factors responsible for phobias. So approximately 15% of the world population suffers from at least one or more than one phobias in general. So what are the consequences of these phobias? So consequences can be devastating because number one, this fear causes or phobia causes anxiety. Anxiety may cause either depression or overactivity, or may affect the decision making process, or may affect the way one individual lives, either in the household or in the workplace or in study areas like educational institutions or religious institutions. And the phobia would definitely affect the behavior of individuals in a social environment or atmosphere. And phobias may decrease or adversely impact the productivity of individuals. And phobias may adversely impact the overall mental and physical health aspects of individuals and may pose a threat to the economy of an entire country. So phobias are not very simple, and they are complex environmental, genetic, mental and physical phenomena completely combined together. So the impacts can be devastating and often distress causing. So hence we should look at something called as the treatment part of it. So what is the treatment of these phobias? Treatment can be a multi-pronged strategy in general. Treatments can be in the form of number one, systematic desensitization is the primary type of treatment we can have for phobias, various types of phobias. What is systematic desensitization here? Number one is gradual exposure of the affected individual to those situations or objects or creatures or persons gradually, and so that the individual may develop a sense of confidence and trust, and gradually by this regular confrontation may lose the fear or may address the issue of phobia gradually. This is systematic desensitization. Next type of treatment is progressive relaxation. This includes a kind of psychotherapy, and with the help of psychologists and psychiatrists and with the help of counselors, through counseling, with the help of family members, we can proceed with progressive relaxation, that is to avoid any kind of occurrence of panic attack or anxiety affecting the overall health of the individual. Gradual and progressive relaxation through meditation and all other techniques can be applied on affected individuals to have a kind of better prognosis. Next treatment is virtual reality. So virtual reality is one technology enabled treatment method which can help individuals confront the situations or creatures or persons or objects which in real time may not be possible, either because of excessive phobia or panic attack or a risk of the health getting affected directly, or because of ethical and other regulatory concerns. So we can take the help of technology, that is virtual reality, and take the individual technologically closer to the sources of this phobia and gradually enable the individual overcome this fear or phobia, and then we can reintroduce the individual to real-time scenarios or situations or objects or persons or creatures, so which may help the individual better cope with the phobia and recover earlier or faster. Next treatment method is medications. So what kind of medications can we suggest to individuals with phobias? Those would be in the form of number one, antidepressant drugs. Number two would be benzodiazepines, so that the individual may relax and gradually recover better. Number three would be beta blockers to avoid any kind of attacks or panic attacks on the individual affecting overall health. Number four would be antihistamines. So these four different types of drugs or medications can be given to individuals who are victims of phobias. And next treatment method is hypnotherapy. So hypnotherapy can be one best tool when all other types of treatments fail. So hypnotherapy is gradual psychological like modulation therapy which can help individuals recover better without any kind of medications and side effects. The most effective and research-based treatment for phobias is cognitive behavioral therapy, which is called as CBT. So cognitive behavioral therapy is gradual informed alteration or modification of behavior of affected individuals, and this includes appropriate enculturation and socialization with their surrounding environmental conditions, social and other aspects concerned with the life of individuals across educational, religious and professional environments. So, cognitive behavioral therapy is considered as the very effective and modern method of treating people with phobias. So, if you feel that the content of this video was useful to you, please do not forget to like, share and subscribe to our channel VinIQ, and please give your valuable feedback in the comment section below so that we can make better and more valuable content in the future to you. Thank you.